Please state your name for the record.
Maya Kowalski.
Maya, you have a very soft voice, so you'll need to get that microphone up there close so everybody can hear you. And where do you live?
I live in Venice, Florida, in a subdivision called Stonewalk.
And how old are you?
I am 17 years old.
Where were you born?
I was born in Elmhurst, Illinois.
Outside of Chicago?
Yes.
What kind of neighborhood?
It's a really small neighborhood. There was barely any houses. There was houses on both sides of the street, but only a single street.
And how were things growing up in your family? And we'll publish 2528-45 for this. And you can continue.
Okay. So here I'm pictured with my dad's deputy chief fire helmet. You could tell I'm feeling pretty cool there. Growing up, Elmhurst was amazing. I loved it there, and it was like a quiet little place.
And did you get to spend some time with your dad and mom?
Both of them, yes.
They both worked?
Yes, they did, but they always made time for their children.
Did your dad ever take you to any fires?
He actually did take me to a few, but eventually he started dropping me off at my neighbor's house. The grandma was Polish, so Kyle and I could communicate with her pretty well.
Okay. And so during your time there in Elmhurst, did your mother or your dad introduce you to different hobbies and sports?
Yes. I was a ballerina at one point. I was a gymnast and then a figure skater. And then Kyle, he played soccer, he did piano, I also did piano. And then Kyle tried out gymnastics for a little bit.
Okay, let's show 2528-102. This is your mom and you ice skating. Was
Yes.
she your instructor at first?
At this point, no. My mom didn't teach me figure skating. She actually started after me. Here, we're in the Wizard of Oz production. I was a munchkin, and then my mom was a cowgirl.
Okay. And did you, let's go to 2528-115. How old were you when you were introduced to gymnastics?
I started gymnastics in Illinois. There was actually an incident on the playground. I approached a few girls and they were practicing their floor routine, and I asked if I could try, and they told me, no, you're too small, you'll never make it. So I went home, I told my mom, sign me up. She did, and I was actually really good at the sport from the beginning.
And you continued that through when you moved to Florida initially?
Yes.
All right. And so were you able to spend some leisure time with just your mom? And we'll look at 2528-124. And by the way, so your mom didn't introduce you to gymnastics. You had the idea?
Yes, I did. Same with piano, and then ballet, all of them. They were all my ideas.
Right. And your mom supported you in those?
Always.
And that story you told, has that been indicative of your life when people tell you you can't do something?
Oh yeah, I'm going to prove you wrong.
All right. So this is you and your mom now. Where is this? Is this once you reached Florida?
Yes, so this is actually Casperson Beach. It's the shark tooth capital of the world. There's a cute little restaurant there called Sharky's, and near it is this little pier, and after dinner we would walk on the pier and watch the sunset.
Mm-hmm. Was that something you and your mom did regularly, or tried to do?
Yeah, we did it quite often, actually, all of us as a family.
How was the transition from the suburbs of Chicago down here to the Venice area for you?
For me, it wasn't too bad. I did have my mom's family there and friends, but I was hopeful that I'd make new friends in Florida. And the idea of having a pool was really cool, so, I mean, that helped.
Mm-hmm. That was the inviting thing, the bait?
Yeah.
All right. When you moved to Florida, and really during this period of time before the CRPS, can you tell the jury about your health generally?
Generally, it was really good. I mean, I did have asthma. I was diagnosed in Illinois, but it didn't bother me so much.
And just childhood illnesses for the most part?
Yeah, I did break my arm at one point.
So tell us about that.
Yeah, so in our subdivision, the road, it went up on a hill. So I rode up the hill, and then I did like a little U-turn, and I was going down, but there was a car behind me. I saw it, I freaked out, and I crashed into this curb, and then I fell into a ditch directly onto my arm, and I broke it. After that happened, I didn't cry. I stood up, picked up my bike, dragged it out of the ditch, hopped right back on it, drove home, and I told my dad that my arm hurt, and he didn't think anything was wrong because I wasn't crying or acting, all dramatic. He told me to go lay down. I did. We didn't think much of it. A few days went by, and I was holding it in a weird position, and my dad's like, we should probably go get that checked out. So we went to the doctors. They ordered an x-ray. We went home. We got the call from the doctor that it was fractured, and only then did I cry because I realized I wasn't going to be able to do any of the activities that I enjoyed.
So how many days did you have a broken arm without complaining to your mom or dad?
3.
How was your pain tolerance generally?
I've always had a really high pain tolerance.
So how old were you when you moved to Florida?
I was in 3rd grade, the beginning of 3rd grade, so I would say 8.
And how was that? How was the transition?
It was good. Yeah, I liked all the new animals. The lizards were really cool. I actually used to catch them and pinch them on my ears so they looked like earrings. And then Kyle and I, we loved going outside. We had like a little alligator in the back, and we named him Dzień dobry, which means hello. We did that for my mom.
And so I want to talk for a second now. Your mom, first generation Polish.
Yes.
Right? And how early did she start you learning Polish?
Well, we grew up learning the language. We heard it from our family and whatnot. But she enrolled us in Polish school in Illinois. In Florida, we didn't continue with that. We just did Rosetta Stone because there was no Polish schools in Florida. But Kyle and I hated Polish school in Illinois, but we did it for her.
Now, pardon me for asking, but what does one do in Polish school?
So the teacher exclusively speaks in Polish, which is kind of hard because then you don't really know what English words match up with the Polish words. We learned the alphabet, the numbers, and then different materials relating to reading and whatnot.
Would your mom speak Polish to you at home?
Yes.
How often?
I would say every day. I mean, I heard Polish from her, and I actually asked her to speak to me in Polish so I could get a good understanding of the language.
And you had relatives that spoke just about only Polish?
Yes, most of my mom's family only speaks Polish because they grew up in Chicago, which is one of the biggest ethnic areas for Polish people, so there's not really a big need to learn English.
Did you actually go to Poland at some point?
I did, yes. I went there for a month.
When? About? How old? Let me put it this way. Was this before or after you moved to Florida?
It was before I moved to Florida.
Tell us what you did there.
We visited about every city you could think of, all the cool cities. We saw like street artists doing cool things. We went to different shops. I actually bought a Polish doll there, which I was really proud of. We visited family, my mom's old house, and then my great-grandma, actually, I visited her.
Was your mom proud of her, of being Polish ancestry?
I would say so, yeah. She was very proud to be Polish.
Did you know about her story? Did she ever tell you how she ended up over in the United States?
I know that she moved over when she was a teenager, and she had to learn the English language. It was difficult at first, and a lot of people told her she's not going to make it into the profession that she wanted to be, but she proved them wrong.
Now, was this during, when, best of your knowledge, when she moved, strike that, did she grow up under communist Poland or free Poland?
I believe it was communist.
she tell you stories about that?
Not too many. Kyle and I were really young, so.
And is that still important to you, your Polish heritage?
Yes.
All right. And so I want to ask you about the neighborhood itself. Did you have friends there? Friends on or near your age?
Yes.
Several of them?
Yes.
And did you get along with them? I mean,
Yeah, we got along. All of us did.
where'd you go to school?
Well, for elementary school, I went to Taylor Ranch Elementary School.
And how was that?
I really liked it. The teachers were amazing, and it was very different than Illinois.
What was the difference?
Well, something cool about the schools, which is kind of normal for Florida, but very foreign to people who live in Illinois, is that the hallways are actually outdoors. So you walk outside to get to your classes, so it's nice just to see some daylight.
You can't really do that in Illinois.
No.
Not if you want to keep your toes. All right. So, did you generally do well in strike? How did you do in school over this period of time, having moved to Florida?
I was a straight A student.
And you liked your teachers?
Yes, I loved them.
All right. So, let's jump ahead then. What grade did you start at once you moved to Florida?
It was third grade.
Third grade. So you completed second grade
In Illinois.
in Illinois, so it was third.
And I actually did a week of third grade in Illinois as well, but I did the remainder in Florida.
I was going to ask you. So
Yeah.
they come down and visit you every once in a while?
Some of my friends, yes.
Now, by this point, was your dad still in the fire department, or had he retired after all those years?
When we moved to Florida, my dad had retired.
And what did he want to do with his career, if you know?
Once he retired,
Yes.
I think he just wanted to take care of us, spend more time.
Did he have any dreams or aspirations, to the best of your knowledge, about working for FEMA or something else similar to what he had done in the fire department?
I've heard of that, but again, I was really young, so I didn't really know his career plans.
Well, let's jump then to July 3rd and July 4th of 2015. Now, how old would you have been then? This would be...
I would... 2015?
Yeah, so this would be... you've been in Florida, I think, yeah, you moved in 2014, so this would be 1 year after you moved.
I was 9 then.
All right. And then we can show 2528129. Now, what's happening here, although the jury, I think, has seen this?
Yeah, so my subdivision, we're really close, and the adults of the neighborhood, they organize special things for the holidays, and one of the biggest ones is the 4th of July parade. Everyone is welcome to hop on their bikes and ride around our circle. We just celebrate, and then afterwards we usually eat food.
Were you able to ride that bike well, or do you have any physical injuries at this point?
I know I had an injury to my ankle, but again, I was always pushing through, so here I don't really look like anything's wrong, but I hurt my ankle.
How soon before this was it that you hurt? Was this like a month before, a week before, a day before?
I'm going to be honest, I'm not sure, but I know that it was pretty close. I just don't know for sure if it was like weeks.
Well, how bad was it? Was it a sprain, a break?
I believe it was just a sprain.
Did you get any medical care for it at that time? Do you know?
I don't think so, no.
Did you even tell your folks? Is the question.
Yes, I did. My mom had wrapped it and everything.
But by the time of this photo, 2528129, it looks like you can pedal the bike.
Yes.
Very well. All right, and that's your brother next to you?
Yes.
And he got rid of that beard eventually? He just didn't work
Yeah.
for him. All right, so what happened? Tell the jury what happened over that 4th of July weekend that changed your life.
I had a severe asthma attack, and it was one of the worst asthma attacks I've ever had. I was taken to Hopkins All Children's Hospital, and I think I stayed there for a couple of days, if I'm not mistaken.
Well, on the day that it happened, did they take you to the ER someplace else? Doctor's
Oh,
hospital?
doctor, yes, my bad.
All right. So if it happened on the 4th then, was it a matter of a couple, 3 days before you went to Johns Hopkins?
Can you repeat that? Sorry.
Sure. About how many days after you were treated at doctors, and after you had this asthma attack, did you go to Johns Hopkins?
I don't know the number of days. All I know, I wasn't feeling well.
Okay. Well, let me show you 2529-5, and I'll represent that that was taken on or about the 7th or 8th. Actually, it's got it down there.
The 7th.
The 7th. All right, what's going on here?
I am in a bed at Johns Hopkins All Children's Hospital.
All right. And did you walk into Johns Hopkins on this visit?
I believe I was able to walk in on this day, but when I left, I was having extreme complications with walking to the point where I had to be wheeled out in a wheelchair.
Well, the jury needs to know how this came on. You just wake up one morning and bang, you were in extreme pain, or how did it start?
It wasn't like that. It was pretty gradual, but not in the sense that it took like 3 months until I had excruciating pain. It was day by day I noticed that there was a pain in my right leg that was just getting worse and worse.
So it started in your right leg?
Yes.
And did it stay in your right leg or move?
Unfortunately, it did move because I wasn't diagnosed for quite some time.
Did it move or start moving during this stay or after? In other words, during this, was it just in your right foot and leg at this point?
At this point, no. It had traveled to the left leg as well.
So about how long did that take for it to?
It would have been 3 days then.
And so there, they give you something. I know you were very young. Do you remember much about this day?
I'm sorry, I don't.
Well, they'll have those records. All right. So after this, now, did you go home or did you go to another hospital from there?
Well, after this day, I know I went home, but then I was at one point transferred to another hospital.
Was that the one back up in
Illinois?
Do you know if you went back to Johns Hopkins for a visit before you went to Lurie's or not?
I know I had been to Johns Hopkins a few times, but I don't. It's really hard for me to remember. I was 10. Every hospital was the same to me at that point.
Yeah, and the jury has the records. All right. So let's publish 2529-19 and tell us what's going on here.
This is after I got off the plane that I landed in Illinois. My dad had some of his old firefighter friends pick me up off the plane and transfer me in an ambulance. And then the chief, I believe, went to baggage claim and got my mom and I's luggage.
So his old firefighter buddies helped out.
Yeah.
Mm-hmm. Now, looking at this photo here, it doesn't look like you're having much fun. I hate to put words in your mouth. But
yeah,
do you recall any of this?
I remember it was a very difficult plane ride. I mean, I was trying to be respectful to all the passengers, but when you're in pain, it's just so hard to stay quiet.
All right. Well, by this point, then, about how this is what, a few weeks or a month after the onset?
Yes.
What happened with the pain? Did it stay the same? Did it decrease? Did it increase?
It had increased.
And where did it increase to physically? Were there any new places or the same?
There was new places. At this point, it was at my midsection, and it was, I don't know for certain, but I know it did transfer to my arms at some point. I just don't know the specific date.
When you say now midsection, explain a little bit more. Are you talking about your tummy or your abdomen? Where?
Yes, I'm talking about my stomach.
At this point, had you started to have problems with any digestion or going to the bathroom? Or was that later?
Yes, I had constipation issues, and we later found out that it corresponded to my diagnosis of CRPS.
And what happens there with those going to the bathroom issues?
Do you mean like how CRPS is connected to it, or just...
Just physically, how did it manifest? What was the problem there for you?
I was just constipated, and when Miralax didn't work, we had to go to the hospital.
So did this start right off the bat once you had the pain in the midsection?
Yes. Yeah, I did have constipation.
Was it fairly consistent throughout your various stays at Johns Hopkins? You had this problem in the midsection where you'd get stopped up?
Yes.
Okay. All right. So do you recall what they did for you there at Lurie's?
I know that they suggested an intensive physical therapy program, but they also missed the diagnosis of CRPS.
All right. So they didn't, at this point, did you know what was really causing your pain?
No one knew.
And what was the effect on your mom and dad not knowing? Here you are a month or so after it manifested, it came on. How did it affect them?
Well, my parents were extremely worried, and in turn that made me more anxious because as a kid you look up to your parents for the answers. And then when they look up to the doctors for the answers and they don't even have them, you're just so unbelievably anxious.
So you came back home then, I guess?
Yes.
And did you go to another hospital after that?
Yes, my parents had taken the suggestion from the Illinois hospital, and we went to an intensive physical therapy program at Tampa General.
About how long was it from Lurie's, the hospital in Chicago, to when you went up to Tampa General?
I'm sorry, I don't know the dates.
The same summer period, or?
Oh yeah, it was the same. Mm-hmm.
Okay. All right. And how was your pain doing at this point?
My pain was still pretty bad.
Had anybody approached you at this point at Lurie's and said anything about this just being all in your head, or was that? Did you know anything about that, or was this just something you found out later?
I found that out later.
And was it in your head?
No.
Okay. So let's talk about and publish 2529-23. Okay, and where is this?
This is in the PT room at Tampa General Hospital.
And what are they having you do there?
This is a machine that is intended to strengthen your arm muscles.
Okay. How many hours of PT were you doing a day there at this time, if you recall?
I don't know the number of hours, but I remember Marissa, the physical therapist, because it's an intensive program, the PT, I believe, was like 2 to 3 times a day.
And what did they tell you about why you had to do the PT?
Well, none of the doctors knew what was wrong with me at the time, so they just assumed that strengthening my muscles would maybe help get me to walking again.
Mm-hmm. All right. Now, the space you're making here, does that fairly and accurately represent you in pain?
Yes, I'm trying to smile here, but unfortunately I was still experiencing a lot of pain.
Well, had it traveled up to your legs, to your arms at this point? Or
At this point, yes.
had you manifested any other symptoms? Now, looking back, not that you knew at the time, during this stay, if you know.
I can't say for certain, but I believe I started seeing some lesions, and I was very sensitive to touch. I know that for sure.
So how was PT for you at Tampa General?
It was very challenging. It's excruciating.
Mm-hmm. And was Miss Marissa, who testified here, nice to you?
She was lovely, yes.
All right. And were you outpatient or inpatient?
I was
In other words,
inpatient, yeah.
So you stayed there?
Yes.
And you remember for about how long?
A month.
All right. Now here, were your parents allowed to stay with you?
Yes.
All right. And let's then publish 2529-34 and ask about this. All right. Now, is that Marissa there in the green?
In the green, that is Marissa.
And what's that on your feet? What are you doing there?
So that machine is for pedaling,
Mm-hmm.
again, just in hopes of strengthening my leg muscles.
Now, at this point, a couple months maybe past when it came on, it looks like you still have some pretty good muscle mass in your legs.
Yes, and then I don't know if you could really tell, but you could see that my dystonia is starting to get worse.
Uh-huh. That means your toes pointing in?
Correct.
Tell the jury about that. There were allegations that you somehow made this up. Could you have any control over your feet when they started to go into that position?
I had absolutely no control over that.
What did it feel like when they began turning in?
It was extremely painful, and it was like tense, if that makes sense.
All right. Who's that person behind you?
That is Bonnie Rice.
Uh-huh.
I kind of call her like the Kathy Beatty of Tampa General. She was a nurse, but overstepped in many ways.
So she followed you around,
Yes,
and she wasn't quite as nice as Marissa.
definitely not.
Why did they have a nurse following you around everywhere?
At-
Subject to the situation, Your Honor.
She knows.
Sustain once you re-ask.
What, if anything, do you know about why Bonnie Rice was following you around here?
I had the understanding that Bonnie Rice, even though she was a nurse, she believed that I had either conversion disorder, so I was like making up my disease. I don't know what child would want to pretend not being able to walk and not being able to play with their friends, but she drew that conclusion. She also had some problems with my mom because she expressed these concerns to my mom. My mom knew I was not making this up. She knew her daughter.
So wherever you went, there was Bonnie Rice?
Yes.
So eventually, and at this point, were you completely in a wheelchair?
Yes.
Okay. And so then, did you even have to go to school? Once you got out of there, did you have to go to school in a wheelchair?
I did visit my school in a wheelchair for the lemonade stand fundraiser they had for me.
Okay, let's publish 2529-39. We'll come back to TGH. Now, what's this?
This is the school bus that had the lift so I could be brought to school in my wheelchair.
Okay, and this, it looks like it's September 21st, 2015. Was this after TGH?
To my understanding, yes, I believe so.
Okay, well, let's, or maybe it was before. Let's go back to TGH. Now let's publish 2529-41. Now what's that?
That is a CRPS lesion.
Right. And tell the jury how do you identify that?
Well, at the time, I still didn't know I had CRPS. Nobody did. So I started getting these open sores on my body, and I was very concerned because it's something I've never had before. And they're very painful, especially when you touch them.
Mm-hmm. And did they hurt
Extremely, yes.
to the touch or just whatever you did?
When you put touch on them, it amplified the pain.
And so let's look at 2661. Now this is a video, and I'm going to ask you after this, what's significant about, first, was this after TGH?
I don't know what day. Oh,
All right. So after this, I want you to tell the jury what's significant about this. And the date on it, I believe, is sometime September of, again, 2015. kind of one note off.
It's okay.
Now, to those that I guess play piano or not, what was happening with your legs?
Okay, so to people, you probably don't notice this if you're not a pianist, but there is a distinct sound when the pedals are being pressed. At this point, I was not able to press the pedals even though the song called for it, so I had severe dystonia and that limited me from being able to do that.
Were you, obviously you're able to play piano, were you able to do any of the activities that you had before? Or?
Other than piano, I was not because all of them required me to stand and walk and jump.
Okay. Now, here we are in September of 2015, and you're in a wheelchair. What other signs, what if any other signs of or symptoms of CRPS did you note at this time?
At this time, I was twitching. I had the allodynia, dystonia, lesions. There was the temperature changes in my limbs that we started to notice.
Tell the jury about the temperature changes. Why is this any different than just being chilly or it being too hot or too cold? Turn up the air conditioning or down the air conditioning.
Because it happens at random times and it's not influenced by external temperature. It's all internally happening. And then another thing that was weird that started happening is I would sweat in different areas, but not all over my body.
What areas, if you recall?
The back of my neck, and then lower back. I don't remember all of them, but those are the two that I specifically remember.
And were these dependent on whether you were cold or the exterior temperatures at all?
No, they were not dependent on the external environment.
Well, what else? Anything with the ears or eyes?
I did have tinnitus, which is just ringing in the ears, which I've never had before. And then with my eyesight, at this point, it was okay.
All right. And, okay, so your eyes are all right. So, through this period of time, did you get to see Dr. Wassenauer?
Yes, I did.
And he couldn't figure out what was wrong yet either?
No.
All right. So then did there come a time when somebody did know what was wrong with you?
Yes.
All right. If we could publish a video of 2666, and then you'll tell us if about this in a moment.
That doesn't feel good when I touch your legs, right? Or your tummy, when I touch your tummy, that feels good, right?
All right. Now, were you in distress there?
Yes.
Was that the kind of reaction you would get sometimes when people would touch your legs?
Yes, it's just from the allodynia.
All right. So the jury wants to know if you have this effect when someone touches your legs, how are you able to deal with blankets being pulled over, clothes being put on, any of the usual things you do if you have this reaction?
A common misconception with CRPS is that all of the symptoms from the beginning to whenever you have it, they're constant, and then they stay that way. But in reality, symptoms can change on a day-to-day basis.
So sometimes you, like we saw in the video, you'd have the blankets off of you and sometimes on,
Yes,
depending on the day.
correct.
Was this frustrating?
It was. It was annoying to constantly have to tell people to help you with certain things, especially with the temperature changes, because you want to be comfortable, and here you're asking people to change either this thermostat or help you with blankets or help you change into something else, and you know you can't do it for yourself, so you just feel like an inconvenience.
Yeah. Have you always been a pretty independent person?
Oh, yes.
Did your mom want you to be that way, independent, be able to handle things on your own?
Yes.
Okay. Do you know how, just if you know, you got to Dr. Kirkpatrick from the prior doctors you'd seen?
I do know the story.
Okay. Tell the jury how you ended up at Dr. Kirkpatrick's, and then we'll show. I think we can bring up a photo 2529-42, and if you could just tell them what happened, how you got there.
Yes, so my mom was an infusion nurse during this entire time, and while I was at Tampa General, Bonnie Rice, the nurse I told you about earlier, she had a phone conversation with my mom, and that's when Bonnie said that she thinks that I was making up my condition. My mom told her, no, there's no way. My mom listed all the symptoms I was having and said, how can she be faking these? My mom went back into the room to treat her patient, and he said, I'm sorry,
I respectfully object to the hearsay.
What did she say next?
Objection to hearsay.
Who said next?
What did, strike it, how did you know that Dr. Kirkpatrick might have some answers without telling us what somebody told you?
I know from the person who told us. I mean, that's how we found him.
Oh, sure.
So,
and who suggested it?
It was the patient of my mom, Dave, because he has a daughter with CRPS.
So a dad of another girl that had CRPS?
Yes.
Suggested?
Correct.
Now, so you went in and saw Dr. Kirkpatrick?
Yes.
And tell the jury what he did in order to determine what was going on.
He had a very lengthy examination of me, and it included multiple different tests, and he took all the data, and then he said that my symptoms and my condition aligns with CRPS.
Did he explain about the Budapest criteria?
He did.
Mm-hmm. And so what types of symptoms did you show in front of him, if you recall?
I believe he did a temperature test of my extremities. He noted certain lesions I had. You could see one on my right arm. And then I had extreme sensitivity to light. It's just with CRPS, the nerves are hypersensitive. I also had dystonia at the time. I believe at that appointment there was no there was no signs of sweating, abnormal sweating, but again, that's just every day is different.
What's up with the sunglasses? Why the sunglasses?
I was sensitive to light, and that's just because the nerves in CRPS patients are hypersensitive. Mm-hmm. And then another, obviously the big giveaway that I had CRPS was the burning pain.
Mm-hmm. And the feet turning in there, that's the dystonia he noted?
Yes.
Mm-hmm. And about how long did he have you over there to examine you?
It was quite a few hours. It wasn't like in and out like other doctors' offices.
Mm-hmm. And did Dr. Kirkpatrick keep you in the mix about what he was doing and why?
Yes, he always told me what he was going to be doing, the certain tests. He asked me if I was comfortable, uncomfortable. He listened to me.
All right, now this photograph is dated, I think, down there in the bottom left. It's October 5th, 2015. Had you seen him before this visit?
I'm not sure
September?
what day I saw him, but I know that he had an examination of me, and then the next time I went in, after trying pool therapy, we tried out the ketamine infusion.
Okay, so important to know, did Dr. K immediately go to ketamine, or did he have another therapy he thought might work?
No, he wanted me to try the non-medicative route first, which we did.
Mm-hmm. And what was that non-medicated route?
It was warm water therapy. My dad had bought a system to heat our pool, so I think like 10 out of 12 months of the year it's warm. Mm-hmm. So I was able to practice my therapy in there and try to gain some strength.
And did you try hard at that?
Yes.
How'd it do?
It helped a little bit, but it was not the improvement that Dr. Kirkpatrick was hoping for, or any of us were hoping for. So he decided it would be best to try the ketamine infusion.
In terms of physical therapy now, well, let's talk about what you had already been through at the different places, at Tampa General and so forth. Had you had physical therapy so far?
Yes.
By this point? Had you had, I guess, occupational therapy, upper body stuff?
Yes.
And had you had some psychological evaluations?
Yes,
interviews?
I had counseling. Mhm.
And did you then have warm water therapy?
Yes.
And what kind of meds had they put you on up to this point of the ketamine? What were you taking?
I'm going to be honest, I was, again, like really young, so I didn't ask what medication I was taking, but it's my understanding I did try some prescribed opioids from my doctors.
Remember anything about whether they worked or not?
They didn't.
All right. So you'd been through physical therapy, occupational therapy, psychotherapy, warm water therapy, opioids. Now you were trying ketamine.
Yes.
Tell the jury how that went.
The ketamine infusion?
Mm-hmm. Yes.
So-
Have we put in 252942? Is that already up? All right. Go ahead and explain what.
So the ketamine infusions were very different than anything I had tried previously. It's this like really small room with a bunch of different equipment and then a nice soft bed. And then super adjacent to the bed is like a little TV so the patients can watch whatever they want while they're getting the infusion. I slept for most of it, so I don't really know the duration of the whole treatment, but I know it was over the course of a few days.
Well, you said you slept during most of it. How were you sleeping at night at this point?
Oh, I was not sleeping. It's very difficult to sleep when, you're having excruciating pain and pain that you've never felt before.
And so, even with your high pain tolerance, describe for the jury as best you can so they can understand what it's like, the CRPS pain.
How I describe it to people who don't have CRPS, it's like I was born with gasoline deep within my body, and some incident, whether it was that sprained ankle or the severe asthma attack, was like a match and acted as a catalyst that just set my body on fire, and I have to live with this burning pain.
All right. And so how many of these, strike that, during the time at TGH, did you also have physical appliances applied to your legs and ankles to see if that would straighten out some of your symptoms?
Unfortunately, yes.
Tell the jury about those, in addition to physical therapy, occupational therapy, psychotherapy, warm water therapy, opioids.
So with CRPS, you have to be very careful with the type of therapies that you provide. And with physical therapy, you have to be especially gentle. Now, I was put into an intensive physical therapy program, and again, at the time, we didn't know I had CRPS, so we didn't know that it was actually doing more damage than good. One of the doctors noticed that my dystonia was getting extremely severe as my stay went on. He suggested that he breaks my feet, have a corrective surgery to straighten them out.
Let's publish 2529-35.
And that was Dr. Kornberg. I remember his name.
Okay. All right, so are those the corrective boots you wore?
Yes, so this was like part one of his plan. He wanted to see if the boots would straighten my feet out, and if it didn't, he was going to resort immediately to surgery.
Now, I can't quite see your mouth there, but what are you feeling there in that facial gesture?
Forcing my feet to immediately go from, completely turned in to straight was an awful idea. It was extremely painful. I remember just crying and crying.
And did your mom want you to try it, though?
She did. She knew it was hurting me, but again, at the time, we didn't know what was going on, so she was just listening to the doctors.
So the jury knows, did your mom ever push you to do any of these treatments, or was this something that you wanted to try too?
I also wanted to try it because I had my trust invested in the doctors. I thought they knew what they were doing.
Through this entire period of time, were you ever pushed by your parents to continue a therapy that wasn't beneficial, or strike that? were you ever pressured to do any types of therapies or things that maybe you already knew didn't work?
No, if we figured out that it didn't work, they were okay with listening to me and not going on with it.
Okay. So how many of the ketamine therapies do you recall having for this with Dr. K?
So after Tampa General, I had, I believe, one, like, not like a single treatment, but because it spanned over a couple of days, but itself, it was just like one session, if that makes sense.
Okay. Now, at this point, if you can recall, I think we have a video, I don't know if we'll see it, but can you show the jury about how high you could raise your arm going into all of this? Can you demonstrate about how high you could get it?
Yeah, at Dr. K's, I believe I told you about the examination, and part of his examination was like a physical, like, range of motion examination. I was only able to lift my hand to about ear level, nothing past that because of the pain.
All right. And so then after that, how did the ketamine therapies do for you, the ones at Dr. K's?
At Dr. Kirkpatrick's office, the ketamine definitely helped. It had helped me more than any of the previous therapies I've tried. So I wanted to stick with that in addition to trying the warm water therapy and continuing going to counseling. But ultimately, Kirkpatrick noticed that his treatments weren't going to get me to where he wanted me to be. So he brought on another doctor.
Okay. And were you continuing the warm water therapies when you were doing the ketamine?
Yes.
How did the ketamine affect your ability to do physical therapy?
Well, obviously I couldn't do it like immediately after. It's a new drug, and I did have some side effects. I was a little bit confused coming out of it, but the confusion doesn't last long. By the end of the day, I was talking in my normal self.
But could you do more warm water physical therapy using the ketamine as without it?
Yes.
And why was that?
It's just because it alleviates my pain. I mean, for the first time, something is actually helping lower that burning pain. So I wanted to try even harder in physical therapy.
How did it feel finally having a diagnosis that made sense?
Obviously, the diagnosis itself isn't great, but it's nice knowing what it is so you can develop a course of action to try to tackle it.
Did your mom, best of what you remember, start researching what CRPS was?
Yes. So my mom, she was an infusion nurse, and she's pretty familiar in the medical field. So naturally, she wanted to learn all about it herself.
In terms of the medical analysis, if you will, for you, between your mom and dad, who would take the lead?
My mom did, because that was her field of expertise.
Okay. So your mom was kind of your home physician or home nurse?
Sure, yeah.
And she was teaching you Polish?
Mm-hmm.
And would she take you to different events and places, drive you places?
Yes.
And was she helping you with your piano?
Yes.
And was she helping you through ballet?
Yes.
Okay. Did you have a good relationship with your mom through this?
Yes, I always did.
How about the fact that she wanted you to try some of these therapies that were hurting you? Did that harm the relationship? Or?
No, it didn't, because again, you have to remember, before we went to Dr. Kirkpatrick, we didn't know what it was. So I think her willingness to try everything was actually a sign of love.
How did your dad react to finally hearing that this was CRPS? I mean, mixed? Or?
I mean, no parent wants their kid to have like a chronic illness. So they were sad, but I think at the same time they were just happy to hear a definite answer.
And how did they react to you telling them that after these ketamine infusions that it helped?
They were so happy to know that, something was helping. Finally, like one thing we try is actually doing something for me.
And up to this point, could they do anything for you when you would have, when the pain would be at its worst? Was there anything they could give you or do for you that would affect it?
Before this, no, not at all. I mean, I remember laying in bed and just crying, and I have this memory of my dad. He took my monkey. You'll probably see it in a bunch of pictures, but he would take the hand of the monkey and rub it on my forehead until I fell asleep.
Mm-hmm. And were you sleeping? Tell us the sleeping arrangement once this got really bad.
Once my pain was to the point where I was just crying and screaming throughout the entire night, the way our house is arranged, first off, is I'm on the opposite side of the house, and then there's my brother's room right across from mine, and then the other side is my parents' room. So I couldn't walk to go and tell them when I needed help going to use the restroom, so we implemented a walkie-talkie system. It sounds silly, but I didn't have a phone at the time, so I would talk back and forth to them so they could help me in the middle of the night.
Could you tell how it was affecting your folks that their little girl was moaning all night in pain?
I try to keep it in as much as possible because
Did
like
they appear to
seeing
be
that
under
face.
some stress?
Yeah, they were definitely stressed out. And
How about Kyle?
oh, for sure. I mean, we used to play together all the time.
Were
Now,
you and your brother close?
yes, we were. Even when we were really little, we had a very good relationship.
It's like you're the big sister.
Yeah.
Okay. How far apart are you two?
We are 18 months.
Mm-hmm.
And then we do have an older sister as well.
That's right, Corrine.
Yes.
How much older is she?
I think she's 16 years older than me.
Okay. And were you close? Are you close with her?
Yes.
How was Kyle reacting to hearing his big sister in this kind of pain?
Well, my parents tried to keep him out of the loop when we didn't know what it was because you don't want to worry your other child as well. But obviously he knew something was wrong. I wasn't walking, I wasn't playing, I wasn't laughing as much. I didn't go outside because I couldn't. So I believe he tried his best to distract himself with the neighborhood kids playing football and whatnot. But he was heartbroken.
Yeah. And so for you, was it difficult to see the other kids outside playing and you in the wheelchair?
Yes, very much so. There was actually one day I was invited to the YMCA, which is where I used to do gymnastics. And I was wheelchair bound at the time, and I never went back to watch them because it just ate me up.
Do you want to get out of that wheelchair?
Yes.
All right. So now, we've tried this, and how long approximately would Dr. Kirkpatrick's ketamine therapy benefits last? After you stopped, how long would it be before the pain would come back?
I would say, I don't know the exact days. I really didn't keep track as a kid, but I believe like maybe a week and a couple of days, but it just didn't last as long as we hoped.
Mm-hmm. All right, so did he make a referral then to try a different approach?
Yes, he did.
And where did he send you?
He called Dr. Cantu. He's a doctor in Monterrey, Mexico, and I went there.
You remember that?
I do, yes.
Do you remember the hotel you stayed at?
I do. I remember pretty much everything about the trip except the 5 days when I was sleeping.
Okay. And so, leading up to it now, did you have some conferences with Dr. Cantu about what was going to happen?
Actually, I had a discussion with Dr. Kirkpatrick first. He explained some of the risks associated with the ketamine-induced sedation, the prolonged sedation. And then when I went to Monterrey, Mexico, I was then again told about the risks.
And how did it strike you? I know you were only, had you turned 10, I guess, by this point?
Yes, in December.
Yeah, because your birthday is when in?
December 10th.
Okay. So, what was your reaction, from what you recall on your age at that time, to hearing that there were some possible complications, some possible risks with this procedure?
Well, I was presented with the worst case scenario, which was a 50% chance of death. Even though that's not completely true, they always give you the worst case scenario just in case something bad happens.
Had you heard that with other medications and things?
Yeah, I mean, every medication has like a ton of side effects. But you know it's bad when like a 10-year-old is willing to take that risk. I mean, that's how bad my pain was.
So, the hotel you were staying at, was it fairly close to Dr. Cantu's office?
Yes.
And so then you, at this point, were displaying pretty prominent CRPS symptoms.
Yes.
That's published 2529-58. Record reflect, this is November 18th, 2015 in Mexico. All right. Tell the jury what's going on here. What are these?
These are CRPS lesions.
And now, what's the deal between the round one and the one that's a line? Although, if we can we go any closer on that to see?
So, to the naked eye, it kind of looks like a scratch, but in reality, with CRPS, sometimes these lesions do present like that, but they're actually connected.
All right, and so down there, right above the green band, I mean, is that another lesion there right off of it?
Yes.
Okay. And were you seeing more of these?
I was.
And what was your worry? I mean, I realize you were only 10. Had you read up on CRPS?
I personally did not read up on it, but I knew other people who had it.
Tell us how you knew other people who had it.
So there's actually she used to live in Mexico. She had CRPS really bad. She had it when she was a kid. She went into remission for a couple of years, actually, and then she got bit.
Your Honor, I apologize for interrupting, but for our discussion, I do object to this line of questioning.
About her having a friend? May I ask her about the friend?
Let's move on to the next question.
So you had friends down there.
Yeah.
And had it come to your attention from various sources that CRPS could take your life?
Yes.
Had you seen examples of that?
Unfortunately.
Okay. And had you seen examples of it going into remission and then coming back?
Yes.
So let's publish 2529-60. The record reflects this is in Mexico, November 19th, 2015. More examples of lesions, is that right?
Correct.
And where are these?
These are on my ankle.
Do you have any lesions right now?
I do have a few on my leg. My right leg, that is.
All right. So then let's publish 2529-61, looking at symptoms. Now here, although obviously were you unconscious at this point in this picture?
Yes.
And why is that significant in light of different allegations people were making against you at Johns Hopkins?
Well, because when you're unconscious, you don't really have control over your body movements. So my feet still being in that fixed position, like pointing inwards, shows that I was not making this up.
All right. And so you, knowing about the risk, you and your parents, did you talk about whether you wanted to do this?
Yes, they specifically asked me, and I know I was really young at the time, but they gave me pretty much full authority of whether I was going to go through with the prolonged sedation or not.
Have you always been pretty mature for your age?
Yes.
I mean, at least in these ways, analysis and so forth.
Mm-hmm.
You were aware of your body and how to take care of yourself.
Yes.
I object to the leading, Your Honor.
Overruled. All right, so then let's publish 2529-69, and I want you to tell the jury a little bit about your relationship with Dr. Cantu. Is that Dr. Cantu who came and testified here?
Yes. He is so nice. He was, in addition to Dr. Kirkpatrick, he was one of the very few doctors who really listened to me.
Mm-hmm. And did he speak mostly English to you or Spanish?
To us, he spoke English, but when we couldn't really communicate with him because we didn't know Spanish, my friend, the one with CRPS, Jessica, her mom, she spoke both language fluently, so she helped translate certain things for us.
Okay. And did Dr. Cantu tell you about this procedure that you were going to go into?
Yes.
Okay. Now, behind you there is a photograph of another patient, I think, next to you.
Yes.
Was that another CRPS patient?
Your Honor, we objection in the HIPAA violation.
There's no, she's
In the
not in the picture.
speculation in multiple bases about talking about other
Sustained.
patients.
All right. So, did Dr. Cantu then go over with you the specifics of how this is going to go and any problems you might have from it?
Yes, he was very in depth.
And so you underwent the procedure. I want you to tell the jury what the procedure was like.
Well, I met with the team of people who are going to be taking care of me prior to going under. I talked to all of them, and they explained what their role was in my care. So I trusted them, and I understood what they were going to be doing. I was told about the potential side effects, what it might be like when I'm coming out of it. I was explained the risks. I got a full in-depth picture view of what was going to happen.
Now, was your mom aware of other CRPS, either studies or real people, where CRPS had gone into remission and then come back to cause their death?
Object to
Yes.
the speculation, Your Honor.
Overruled.
Yes.
All right. So you, how long does the procedure last, this first procedure?
I believe it was 7 or 5 days. I think it was 5 or 7. I think it was like 5 days of the actual medication of ketamine, but then there was 2 days for me to like slowly come out of it.
Mm-hmm. And coming out of it, how were you doing?
I mean, it was a little scary. I had the tube taken out of my throat and I was coughing. I was a little confused about what was happening, but that all went away.
How long did it take for those symptoms or side effects, if you will, to subside?
I believe it was a day until I felt completely myself, but by the evening I was somewhat okay.
And when you say somewhat okay, you've just been through this procedure. How did you feel, Maya?
Oh, like, as part of me, like, physically, I was feeling incredible. I actually asked Dr. Cantu, I'm like, hey, could I try walking? And he told me I couldn't do that because I could potentially, go back to where I was. He said, just baby steps.
So you felt good enough to think you could get out of that wheelchair?
I wanted to try.
Okay. All right. And this procedure was under general anesthesia, is that right? So
Correct.
you were out.
Yes.
So you don't remember anything?
I don't remember anything at all.
Now, did Dr. Cantu recommend that you have a booster soon thereafter?
Yes.
And what did you understand why the booster was necessary?
I know that he had performed this procedure many other times, and it's pretty standard practice for a patient to return and get the booster just to help.
Okay. And that procedure, now, was that back completely under, intubated and completely under, or was that like the times you had it at Dr. Kirkpatrick?
No, it was very similar to Dr. Kirkpatrick's.
So you were not unconscious in any way?
No.
And about how long did those procedures take?
Those were also a couple of hours. I remember taking a little nap, but again, it's just because of the sleeping problem.
Between the two procedures, did any of the symptoms come back briefly or to the point where you're concerned? Or
I honestly don't remember. I know I was doing very well after the prolonged sedation. I think, again, it's just like pretty standard to get a booster.
Sure. All right. And then you headed home.
Yes.
So how did you do that first 30 days after this long-term ketamine procedure? Tell the jury what happened physically in terms of the pain and all of these symptoms and effects that you had from CRPS.
I felt significantly better. My dystonia was much better. My feet were almost straight on certain days. And just in generally, they were like significantly like better. I mean, just straighter and everything. My pain was much lower. And then my lesions had almost completely healed.
And we'll see some photos on that. Your Honor, I'm going to break into another section. Do you want me to continue on, or do you want to?
I think we keep going.
Sure. All right. Returning from Mexico, let's look at 2530-3. And so this is, it looks like, December 24th, Christmas Eve,
Yes.
2015. So were you out of the wheelchair?
No, I was still in the wheelchair, but if you look at my arm, the lesions are a lot less prevalent, and then my feet generally look a lot straighter. There was some dystonia still.
Can we focus in on the feet there? Okay. All right, there's a couple of black dots there. What are those? Are those?
Those are just healing lesions.
All right. But they were not active?
No.
All right. And I notice you're smiling here. Is that simply because of the Mickey Mouse ears, or are there other reasons?
No, I was just a happier kid in general because my pain was, I had some relief finally. And my mom and my brother were not in Mexico for the booster treatment, so I was happy to see them.
Okay. Let's then publish 2530-6 and ask you whether you were getting strong enough to do some energetic playing in the pool.
Most definitely. So at Dr. Kirkpatrick's pre-coma, I said that I could lift my arm like ear level, and now it was above my head, and I could handle my brother touching my legs here, and my feet are much straighter.
And that's December 28th, almost the end of the year.
Yep.
Okay. Then let's publish 2686, see how you're doing even a week later.
Cute girls. Really cute. Got it.
Who's that? Was that your friend from Chicago?
Yes. She had come to visit me, and it was perfect timing because I was feeling a lot better than I had been.
Okay. And could you have moved your arms and legs like that before you had the infusions in Mexico?
There are some days where you could see some movement, but nothing like that.
All right. And then published 2530-27. Did the improvements continue for you?
Yes.
All right. And again, I see you're holding up your arms. Could you hold your arms up that high before the Mexico treatments?
No, I could not.
And I notice your legs there sitting sort of cross-legged. Did you sit cross-legged a lot?
Yeah, that was pretty typical for me. I don't know why, but when I was sitting in that position, there was some difference in my pain. It wasn't as dramatic as I would have liked it to be, but generally it made my pain less.
Was it the most comfortable position for you on sitting on things?
By far.
Okay. That eased some of the dystonia?
Yes.
All right. So let's then look at how you continue to improve. And did you continue to improve through the spring and summer?
Yes.
Okay. Let's publish 2691. And as we're doing it here now, your family likes to scuba dive?
Yes, that's a
So we
common
can
thing
see
in our family.
what's going on now. And what's that on your wrist?
That is a bracelet that my cousin Matthew Klein gifted to me. It says never give up, and that kind of became my motto.
Okay. Okay. All right, and the date on that, the record reflect is April 30th, 2016. So you try to spend a lot of time in the pool to
Yes.
strengthen up? That's the idea? And did your dad work with you a lot on the physical therapy?
Yes, kind of my whole family did. That was kind of cool about it because it was also like family bonding time.
All right, published 2530-41. And this is May. Now we're into May. Okay. And you got your legs, one leg crossed, sitting on the other. You're able to do that, obviously.
Yes.
And you're obviously capable of eating gummy bears.
Yeah.
All right. And did your brother feel better now seeing you able to do some things with him?
Oh, yeah, for sure.
Now, how did you get around on the floor? Did you have to get in your wheelchair to move from one spot to the other, or were you able to crawl, or what?
I was able to crawl a little bit, but I also used my wheelchair to get from like place to place if it was like longer distances and if the floor wasn't comfortable. Another significant thing was I was actually able to push my own wheelchair, so I had some independence in my movements.
And was that a happy-making thing for you?
Oh yeah, I was extremely happy.
Gave you a little more freedom? All right. So through the course of the summer there, were you getting stronger and feeling better?
Yes.
All right. Was it always so, or did you have some ups and downs?
Ups and downs, which is kind of expected with CRPS.
All right. And so let's see. I would like to publish. Who back then was your favorite singer?
I loved Meghan Trainor.
Okay. And let's talk about how you were doing in July of 2016. If we'll play the clip, just 3600 to 47. It's a brief clip from, and you can tell us what you're doing here in a moment. At this point, did you have limited use of? Oh, here you go.
My apologies, counsel. What's the date of this, please?
This is July 28th, 2016. Yes, July 28th. No, let's see. The clip is 26:59 on July 28th, 2016. You're moving pretty good there, Maya.
Yes.
Okay, but still not out of the wheelchair.
No.
Were you hoping to get out of that wheelchair?
Yes, I was on the track to be getting out.
All right. And so when you had some periods where the pain would come back, was it as strong or was it less than what you'd expected, what you had experienced before the Mexico infusions?
It was less than what I experienced previous to the prolonged sedation in Mexico.
All right. But did you continue the ketamine program through the summer?
I did because it's what worked for me.
Okay. And so you would go back for sets when you needed them, and there were a lot of them at some points and none at others?
Right. It just depended on my condition.
Okay. Did you try with your folks, did you try other types of treatments?
Yes. So even though we established that the ketamine had worked for me, we learned about the hyperbaric chamber, so we gave that a shot.
And how is that supposed to work? If you know, if you don't know, it's okay. But
I really don't understand the whole thing, but I did try it.
But you were in a high oxygen environment for a while. Is that it?
That's all I know. I don't really know everything else.
You know why you wanted to, your folks and you wanted to try something different than the ketamine infusions?
Well, they were always open to new therapies. They weren't just exclusively going to use ketamine. So when they heard about some success with the hyperbaric oxygen treatment, they gave it a go.
And did they want you to try things that did not involve a medication?
Yes.
And so what about IVIG, the immune system stimulant? Did you try that?
I did try that, yes.
Briefly. And did that do any good?
I don't have much recollection of it being like substantial, but I know that it did help me because I was willing to do it again.
Okay. Now, Maya, you were, as the record reflects, okay, let's see. Yeah. I want to show how you were doing then in June and July of 2016. Now that we get into the summer, I published 2530-46.
Yeah, so here you could see my feet flat on the ground, which was a huge step for me. I was very proud of myself. I'm holding myself up with my upper body strength, and my dystonia is not present in this picture. I was really close to walking.
Okay. And were you looking forward to walking?
Yes, yes.
Let's publish 2530-50. Was it important for you to be working your upper body here?
Yeah, so my goal was to strengthen my upper body enough to the point where I could hold myself up with the walker if my legs gave out at certain times, so I was still safe and would prevent injury. Even though it was painful, I pushed myself.
Okay. Now, continuing then through the summer, were you looking forward to getting out of that wheelchair?
Yes.
Tell the jury by August of 2016, did you believe you were going to be able to get out of that wheelchair?
By the fall, I truly believed it, and I wanted to go back to school, walking.
Now, did there come a time when you, all right, let's play 2659. Did your mom encourage you through these things?
This is the
That's not it, is it?
Nope.
Let's continue, and then they'll get that straight. And it was your mom encouraging you on the walker, if we get to it. And my next question is, were your mom and dad encouraging you through this period of time to get better, get out of that wheelchair?
Always. They always were very positive around me.
So driving you to these different appointments and things, was that a pretty significant time commitment for them?
It was, and it was very difficult, but again, they wanted what was best for their children, and that included, helping me with my treatments.
Mm-hmm. All right. So, and we'll get back to that one video in a moment.
It's 2695.
All right. Then let's do 2695.
That's better. I love you. Now go down slowly.
Now, what's the goal there with the
Go
legs?
down slowly. Good job.
Sorry, I did not hear your question.
Good job. Very good. Excellent.
Mr. Anderson, I apologize again. Can you please tell me the date of the video?
July 28th, 2016.
Thank you, sir.
All right. So the goal here by this point, the end of July, was that by the middle of fall you were going to be out?
Yes.
All right. And then did there come a time when you wanted to avoid going back to school in a wheelchair?
Yeah, I was the only kid in a wheelchair, so I didn't want to be that kid going back to school.
How were you going? What was Homebound?
So that's a program where the teachers will come to your house and actually give you instruction.
Okay. And did you like that? Did you like your teachers?
I love my teachers. I mean, the fact that they were willing to take time out of their day to come and teach me, it meant everything.
And could they work around your treatment schedules?
They did, yes.
What was your concern with going back to school insofar as your treatment schedules?
Well, I would be missing instruction. I probably would miss assignments and my grades would drop. And I really didn't want to jeopardize my education, so we tried a different route.
Okay. And did it trouble you quite a bit then that you were going to have to go back to school in your wheelchair?
Yes.
And what did that lead to?
It unfortunately led to a relapse.
All right. Well, this was your first relapse since Mexico? Or?
Yes.
Your first relapse ever, really?
Yeah.
Okay. So did you go back to Dr. Hanna to complete more of a ketamine infusion set?
Yes, I did. We went to him because it's less expensive compared to Kirkpatrick.
Okay. And through the course of this now, what were the symptoms that you were displaying insofar as your stomach? And remember we talked about before the intestines and so forth. What was going on in this relapse? Or strike it. What had returned?
So with CRPS, it's pretty well known that it could affect some organs, and for me, it affected my large intestine, so I often got pretty constipated. It's because both, CRPS, it's an attack on the sympathetic nervous system, which also affects the digestive system, so I was pretty constipated regularly.
And from time to time, did you end up in an ER for the constipation that resulted?
Yes, when our remedies at home, like Miralax, didn't work, we were forced to go to the ER.
To get cleaned out? Gross,
Correct.
but
Yeah.
yes. Okay. And then let's publish 2530-61. And for the record, this is October 6, 2016. How are you sleeping at this time, by the way, at home?
Wasn't sleeping very well at night, so I took the opportunity whenever I was tired to sleep. This is during one of my infusions at Dr. Hannah's, and I'm taking a nap